About 15,000 underinsured residents could see their health care expanded under a new proposed public-private partnership by Senator Dennis Rodriguez Jr. Here's more.
The way that the way we propose this contribution.
The current chairman on the Committee on Health proposes today to incentivize private insurance companies to take on uninsured low-income island residents, thereby increasing access to health care for a vulnerable part of Guam's population. Essentially, Senator Dennis Rodriguez Jr. wants to partially privatize Medicaid and the medically indigent program here on Guam.
We're looking at it being managed by the private local insurance companies on Guam. It'll be a Medicaid program, but managed through the private sector, and it's no different from what many states are already doing today. The goals of this plan is to use a combination of funding sources to reduce the uninsured population. That's using the local funds. Federal Medicaid funds that are provided to Guam.
The center identified three major funding sources for the expansion. In 2010, through the Affordable Care Act, Guam received over $260 million. Of that money, Rodriguez says that $150 million remains, but will sunset in 2019. Secondly, Rodriguez plans to partially subsidize the program by imposing a tax on all insurance companies. The senator's office says the fee will not be imposed on the insured, rather on the insurance company's share of the contribution. In addition, it will not cost the insurance agencies because the funds will likely come from their medical loss ratio profits.
To be able to fund this, partial funding would be to impose the 4% health insurance premium fee on all insurance paid on Guam. It's estimated to be about $230 million annually that are paid for health insurance premiums, and as we know now, there are no business privilege taxes or any other taxes that are paid on those premiums.
Rodriguez's plan would expand the eligibility of Medicaid patients from 108% of the federal poverty level to 200%. This would add about 15,000 beneficiaries to a system that already has issues reimbursing current Medicaid patients. To address this issue, Rodriguez's plan proposes to essentially privatize the medically indigent program. He says as of the third quarter of FY 2016, 11,034 participants fell under the MIP. By mandating private insurance companies to take that over, it could save GovGuam money, according to Rodriguez.
I understand potentially adding 15,000 more individuals is a big impact, right? So part of the plan is to ensure that our insurance commission office is beefed up.
While the entire plan requires local legislation, Rodriguez says he has an expert panel that will deal with specific questions regarding the plan, such as how to address the current lack of Medicare reimbursements to Guam or how to address the federal 2% health insurance tax Guam currently pays into the ACA. The panel currently consists of John Jr. Calvo from Congresswoman Madeline Bordalia's office, Francis Santos, an insurance expert and current CCU commissioner, and UOG professor Dr. Diane Jones. And of course, you can read the full proposal online at pacificnewscenter.com.